Dr. K. Sandhya, Ayurveda physician, completed BAMS, completed PG Diploma in Applied Yogic Science, studying Master of Science in Yoga, teaching yoga for last 5 years.
Dr. K. Sandhya, Health Warriors of Yoga Therapy. We are proud of your yogic services.
So, my topic is impact of Sarvangasana on thyroid. So, we will see what is thyroid. Already, madam and everybody told everything related that. So, just like thyroid affects approximately 20 million people in US and all. So, diagnosis is very much important because it affects every system in our body. Thyroid hormones helps to metabolize the fat, carbohydrates, and protein, and maintains our blood pressure, temperature, and heart rate. So I will say it is a negative feedback mechanism is happening in our body, like from the hypothalamus, which is situated in our brain. It's activated by the pituitary gland. Then this gland releases the TSH hormone, thyrotropin, and it sends to thyroid gland, and thyroid releases its hormones like T3, T4, and TSH and all. So the symptoms, the types like hypothyroidism, hyperthyroidism, all those madam already told. Then along with that, there is thyroiditis, goiter, and nodules. Even the cancers are also there. The symptoms like both the hypo and hyper, it is different. Causes yesterday, Dr. Selvamoorthy sir told there are main 5 reasons for the every diseases like lack of exercises, body mind impact, then the stress, pollution, and infection. The same reasons here also in thyroid also we can see. So my topic is effect of Sarvangasana. Sarvangasana, we know it's that shoulder stand posture. In pre-classical textbooks like in Hatha Yoga Pradipika, Geranda Samhita, and in Shiva Samhita also talks about the milder variety of this like Viparita Karni Mudra. And our Lord Yogacharya, because Iyengar already explained that it's the mother of all asana. And in Yoga Magaranda in 1934, T. Krishnamacharya explained these poses. In Hatha Yoga Pradipika Mukti Bhavananda commentary explains about this pose effects on the Vishuddhi Chakra, which is situated on the thyroid. And we'll say yogic intervention, which includes like in Sarvang, while you doing the Sarvangasana and all, there will be neck flexion, extension, and there will be compression and everything. So the minimum we have to do at least 12 weeks, and then only it will be beneficial. We can see in thyroid diseases and all. So next slide. This one. Diet before this one. Diet modification can also be helpful for these disorders. The changes in thyroid hormones obtained before and after, we have to see the results by testing the lab testing and all. Then in body also we can see some changes like before the practice, how the weight, tiredness, and all over the changes like body constipation, tremor, laziness, and in women there will be hormonal changes, menstrual changes, and all. After the practices, we can see random changes in the people also. Then the yoga therapy can balance your energy, increase flexibility, and release stresses. Even though there is increased prevalence of thyroid disorders today, there are numerous treatment options are available. But the difficulty is that when we started taking the medication like modern medicines and all, we have to be in that medicine for lifelong. So with the yoga and meditation, we can help to treat thyroid in a natural way. There is a connection between stress and in hypothyroidism. So we can reduce thyroid by using the yogic tech management. Several studies also have positive results in doing the yoga. Reasons why I selected this asana is Sarvangasana has a profound influence on the thyroid because the effect of thyroid results from the combination of the inverted posture. It is an inverted posture. While doing the Sarvangasana, there will be a bandha like Jalandhara bandha, neck in shin lock. So there will be more flow of blood towards the thyroid, parathyroid, and pituitary, and all over the endocrine system also improved. Then a very good the gravity, the action of gravity is towards the head region. So blood flow increasing, it activates the pituitary. The asana works on the sympathetic, balancing the sympathetic and parasympathetic nervous system. It also reduces the stress and emotions. Then the evaluation posture, as Madam already told, by checking the thyroid function test and all, we can see the clinical blood test and all. Clinically, by physical examinations like by doing the palpitation, by checking the BP, heart rate, and we can measure the weight before and after doing the therapy and examine the face and the skin texture, the puffiness of eyes, then the thinning of brittle nails and all, we can examine externally. Then the hormonal study also we can do. We can use the modern technology like CT scan, MRI, thyroid, ultrasounds and all. Then in cancerous stages and all, needle aspiration test also, it will help. How we can assess the thyroid test. Just you can go in front of the mirror and you can drink a water by sip. While doing that, you just look at the mirror and just below the Adam's apple, if you are able to palpate a nodule or anything, it means that there is a bulge in the thyroid. So structuring the therapy, next slide. We can start with a Sushma Vyayama, especially which is situated on the neck only. We can concentrate more on the neck region, like neck flexion, extension, lateral flexion and all. With the breath, that is the main important point we have to note down here. And the method like Sarvangasana, we can start with it's a supine asana. Just lie down on the supine posture. By inhale and rise your both the legs. By step, you can go up to after reaching the pose. Just be in the posture for at least 3 minutes. We can start with 20 seconds and you can maintain the posture up to 3 minutes. Don't jump directly to practice the Sarvangasana. Directly. Before going to Sarvangasana, you can practice the Ushtrasana, Sedu Bandhasana, Bhujangasana and all those things. Slowly you just go to the Sarvangasana posture. Then you can also start with the support of any pillow or anything on the shoulder. After this, follow like complementary, you can go for the Malsyasana. The contraindications like it is if you have the BP, slip disc or heart problems or anything like that, you just avoid the therapy. The since morning, thyroid glands receives large number of blood. So Sarvangasana helps in improving the blood circulation, which is stagnant over the neck region. Then acute and repeated stress can alter the thyroid hormone secretion, like corticosterone, the end product of hypothalamic HPA axis and strongly regulated by the stress, has been suggested to play a role in hypothalamic pituitary thyroid axis regulation. So we can manage the stress also. Sarvangasana helps to relax and relieve the mental, emotional and stress. So by summarizing, Sarvangasana plays an important role balancing in our Vata dosha. Since the Pranavada, Prana Atra Murdagaha Ura Kandachara, which is situated above the shoulder, So it is good to reducing the depression, anxiety. Savangasana also have a balancing effect on healing the effect on the Vishuddhi chakra, which is situated on the throat, and it awakens the Kundalini in our body. So we can conclude that yogic practices will regulate thyroid hormone secretion function and can improve overall our function. With yoga and meditation, we can maintain a natural health.